Good morning, dear colleagues. My name is Andrzej Barwinski. I'm a consultant anaesthetist at Tove Hospital. This time I'm going to present to you about postgraduate training in anesthesia and intensive care medicine in the UK. The abbreviation ICM on my title slide stands for Intensive Care Medicine. At the beginning, I would like to thank Professor Oleg Tarabrin for inviting me to present about postgraduate training and education on your panel session. It is my absolute pleasure and privilege to be able to share my knowledge. Now let's have a look at the steps required to become a specialist in anesthesia and or intensive care medicine in the UK. There are 9 steps of this process as presented on this diagram. We shall look at each of these steps in more details. After graduation from UK medical school and obtaining undergraduate medical degree, GMC will issue provisional registration to medical school graduates. This means they are now allowed to prescribe medications and perform certain simple procedures like intravenous cannulation, etc. GMC, General Medical Council, is an independent regulator of doctors, physician associates and anesthesia associates in the United Kingdom. Its focus is to support good and safe patient care. GMC was formed in 1858. It regulates how doctors work, ensures good medical practice, keeps register of all medical practitioners, protects patients and holds hearings in cases of complaints against the kingdom. After graduation from medical school, each doctor requires to undergo a 2-year foundation program. In the UK, the foundation program is a 2-year postgraduate medical training program, Foundation Year 1 and Foundation Year 2, that bridges the gap between medical school and specialty or general practice training, requiring all newly qualified doctors to complete it to practice. The foundation program usually involves 6 different rotations or placements in medical or surgical specialty. In the first year of the foundation training, Foundation Year 1, rotates through 3 or 4 jobs in different hospital specialties. The GMC specifies that every Foundation Year 1 must complete at least 3 months in general medicine. The rest of the year may be made up of further time spent in general medicine or surgery or time spent in other specialties, but not in GP practice. After finishing Year 2 foundation program, full GMC registration is issued and doctor can enter to a postgraduate training program in his or her chosen specialty. There are other ways of obtaining full GMC registration if a doctor did not graduate from UK medical schools. These ways include presenting accepted and listed medical school diplomas from around the world, or passing the PLAB test, Professional Language Ability Board test, and equivalent of the final, which is an equivalent of the final exam of the UK medical school, or going through a medical training initiative, MTI, or going through sponsorship. Some postgraduate qualifications like European Diploma in Anesthesia and Intensive Care, EDAIC. Let's look at some of these alternative routes. Let's finish with this step 4, Foundation Year 2, which rotates the doctor through different specialties such as emergency medicine, pediatrics, psychiatry, obstetrics, or pathology. But upon completion of F2, doctor receives foundation program certificate of completion, indicating they are ready to enter a core specialty or general practice training program. Okay. Let's look at some of the alternative ways of obtaining GMC registration. One of them is Medical Training Initiative, or MTI. medical training initiative scheme allows international doctors to come to the UK to train within the National Health Service, NHS. Suitably qualified international medical graduates can receive a maximum of 2 years training and development in the NHS. The knowledge, skills and techniques learned in that time can be used to improve patients' care in their home country on their return. The scheme is administered by the Academy of the Medical Royal Colleges, who issues certificate of sponsorship for local employers or colleges. So Academy embraces all the colleges of all specialties. So the GMC on its website offers a tool which is called Route Finder to help doctors from overseas to decide what steps they need to undertake to obtain GMC registration. I have provided a link for you at the bottom of this slide for more information should you wish to register with the GMC. Step 5 here is a competitive interview for training post in anesthesia. An application can specify his choices in the order of priority. An applicant can specify his or her choices in the order of priority. There are 30 schools of anesthesia in the UK to choose from, including 5 in London area alone. In my region, the school is called Peninsula School of Anesthesia and consists of 2 university hospitals, Exeter and Plymouth, and 4 other regional hospitals. Step 5. Stage 1, let's talk about the anesthesia training itself. Once the doctor finished the medical school, then done foundation year 1, foundation year 2, entered into the his chosen specialty, say it's anesthesia. Stage 1 of the postgraduate training, which is also step 6, is the indicative 3 years. They called CT1 to CT3. CT stands for core trainee. It could be 2 years, it could be 3 years. Anaesthetists in training will be exposed to a comprehensive introduction to elective and emergency anesthetic practice and perioperative care in areas that reflect generalist anesthetic practice. The initial novice period will be directly supervised until the initial assessment of competence progression has been attained. Time is spent gaining clinical experience primarily in a low to moderate risk population, although there will be some supervised exposure to more complex cases. Time will also be spent developing relevant skills in intensive care medicine. Anaesthetists in training will complete the primary FRCA examination during this stage of training. These 2 or 3 years are usually spent in one hospital. There is an alternative route, so-called ACCS entry route, which stands for Acute Care Common STEM. The ACCS curriculum covers 2-year generic ACCS training program whereby trainees rotate through 4 acute ACCS specialties, spending 6 months in each of emergency medicine, internal medicine, anesthesia and intensive care medicine, which means their training is slightly longer, 1 year longer. But many people choose this because it exposes them to more of the emergency specialists, not just anesthesia and intensive care. Stage 2 is called ST4 to ST5. ST stands for Specialist Trainee. Having gained knowledge of the principles underlying clinical practice in the previous stage, in the CT stage, anaesthetists are introduced to wider areas of practice during stage 2 of their training. The focus of this part of the training program is twofold: an introduction to specialist areas of anesthetic practice and consolidation of the skills gained in stage 1 in generalist practice with greater autonomy, whilst developing skills in management and managing a higher risk patient population. Anaesthetists in training will complete the final FRCA examination during this stage of training. These 2 years are usually spent in 2 or sometimes even 3 different hospitals. And the final stage of training will prepare anesthetists in training for the transition to consultant practice. This final year of training allows them to mature the clinical skills required for safe, independent practice. The final stage of training also allows development of the generic professional capabilities to a level appropriate for the award of a CCT. CCT stands for the completion of specialist training. In areas which include medical leadership, management responsibilities, and the ability to teach, train, and supervise others. This final stage equips anesthetists with the expertise to treat patients with complex clinical needs and manage organizational issues. The generic nature to anesthetic practice of clinical learning outcomes will allow opportunities for service providers to provide training in clinical areas in a manner that is flexible to meet service requirements and developments. Completion of stage 3 training will ensure that anesthetists in training are fully prepared for consultant roles in generalist and specialist practice and will lead to the award of the completion of the specialist training. As I have shown to you on this slide, there will be definitely a management course, and sometimes people do an extra year if they want to specialize in pain management or intensive care medicine or some other area like cardiac or thoracic anesthesia. This is a summary on this screen, the summary table that describes generic professional domains and specialty-specific domains, practical skills, and theory exams, primary and final FRCA. So here in this slide you can see that this is the first competency assessment within the first 3 to 6 months. After that, the anesthetist can go on the on-call rota as a first on-call. Then they will progress to CT2 and CT3. Then they will get the stage 1 certificate and they can apply. It's another application after they pass the FRCA exam to become specialist trainees, ST. And within the first 2 years, as like I said, during ST, as 5 years, they have to pass their final examination, final FRCA, and only after that they can progress to the last 3 years of their training, where they will be exposed to all the specialties that listed here in more depth. And listed here we can see cardiac surgery, neurosurgery, obstetric anesthesia, pediatric anesthesia, pain management, bariatric surgery, complex orthopedic surgery, hepatopancreatobiliary surgery, ophthalmology, and all the other specialties, including military. In conclusion, to train to be an anaesthetist in the UK, you need to complete 5 to 6 years of medical school, work as a foundation doctor for 2 years, compete for a place in a specialist training program, compete for a place in a specialist training program, which will last for 7 to 8 years. Excuse me. You will successfully complete the FRCA fellowship examination, which consists of primary and final examination, and then you can apply for a consultant post in a highly competitive environment. After you become a consultant, it doesn't end. We are required to be appraised once a year and revalidate every 5 years, which means we have to present a certain CPD points per year, about 50 points per year, or 250 points in 5 years. So we need to continuously learn, teach, and develop our practice. Here on the slide, there are a few details of the Royal College of Anaesthetists and their website for training and careers. I thank you for your attention and would like to draw your further attention to my educational YouTube channel with just under 80 different presentations on the anesthesiology related topics. The presentations are in 3 different languages, including Ukrainian. To make it easier to find, just scan this QR code or simply type my surname in the search field at YouTube, and you will be able to subscribe to my channel. So don't be shy, subscribe, watch, like, comment.